Welcome back to Heart of Health. We're talking about cigarettes, and I learned something very interesting in the last segment, that our cigarettes have up to 4,000 chemicals and quite a few. How many cause cancer?
They say upwards of 50 of them can cause cancer.
Wow, that's a lot. Well, Craig, that's scary, and and it's hard in our society. We used to talk a lot about cigarette smoking, and lately everything else has gotten more prominent. And H1N1, we talk about that, but as far as killing people, I guess cigarettes are right up there.
400,000 people each year die from cigarette-related diseases.
That's more than dies in any of these wars that we talk about. That is a lot, numbers.
Yeah. I think I read something recently. It's like combined like HIV, auto accidents. There's like 3 or 4 things that are pretty significant that we look at. Combined, smoking kills more than that every year. So.
Okay. Well, here's a question that's come into heartwiseministries.org regarding secondhand smoke.
Right.
This person says, I don't smoke, but my husband smokes about a pack a day. Am I still going to have the harmful effects on my body?
If he's smoking around you, yes. Secondhand smoke's not really any different than firsthand smoke. The person breathes in through a filter and then exhales out, but you're breathing in what he's exhaling out, plus the smoke that comes off the end of his cigarette. So, and they have the same chemicals, the same poisons, the same carcinogenic agents in there. So if you're around him smoking indoors in an enclosed area where there's very little ventilation, it's almost like smoking, firsthand smoke, even though you're not actually holding the cigarette in your mouth. So it's very dangerous. And I see patients all the time like that who've never smoked, and they're wondering, man, why are these people so sick? And have you ever been around someone who smoked before? Well, like you said, my husband smokes a pack and a half a day. He smokes around me at the kitchen table, so you sort of figure out why these people have smoke-related symptoms but not smoking while they're exposed to that secondhand smoke. So.
Wow, and I guess that's one of the reasons why smoking has been outlawed in many, public places now.
Yeah, and that's great for the non-smoker. I think that's one of the biggest moves in the right direction we've made as a society. But at the same time, we sort of made people who smoke very much ostracized. Like they sort of feel like they have to do it in secret places, and we kind of look down upon them now more so than we did before. So it's sort of a double-edged sword. We've really helped the non-smoker and what they're exposed to, but as far as the smoker goes, it's hard for them just to quit. It's very addictive. They need help, and so they're going to find ways to smoke, unfortunately, and they're going to be doing it in more secret places or hiding, sneaking out of work or something to do it. So it's sort of a double-edged sword.
Yeah. Now I hear all these questions about these chemical-free cigarettes. Is there some cigarettes that are safer than others out there? You've heard that all the time. Oh, I smoke with a filter. I'm safe.
I think filters may help a little bit. And when back in the old days, they rolled their own and they didn't use filters. I know the ones that have the menthol are supposedly worse. They have fiberglass supposedly in them, which can cause a lot of problems with the lungs. I would say no cigarette's probably good. As long as you're breathing in, filter's not going to completely stop that. They put holes in the filters a lot of times to make them burn hotter, so the cigarette burns hotter, so you're still getting a lot of the stuff that's in the cigarette.
And like we said, it's an addiction too. It's an addictive substance.
That's right. And it's all marketing. They're going to market, no matter how they try to get people to keep smoking and make it look like it's not really bad for you. Is it bad for you? So.
We have a question about ventilators and tracheostomies when we come back from break. So
sounds good.
Stay with us. We'll be right back after this short break. I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Hi, I'm Dr. James Marcum with your Daily Heartbeat. I have a saying I like to say, and it's this: it's at the heart of healing is love. Now, what would that mean, and what would that have to be with healing? But did you know that love is a way that we can change our body's chemistry? There's been studies done that show people that have animals, which could include a dog or a cat, if they have them, they actually have less heart attacks, less stroke, less infectious diseases, and even less malignancy. Well, do you think it's anything about these animals yelping and barking and meowing that changes the chemistry? No, it's not. It's the love that's shown between owner and manual. Likewise, we know that people that are happily married, if one of the spouse should suddenly die or get sick, that there's a greater likelihood of the other spouse developing a disease. So at the heart of healing is love. And love is one of the most valuable treatments we have to stay healthy. We've been talking about cigarettes, the dangers that it poses to individuals as well as society, and I've noticed that over the years we haven't been emphasizing the dangers of cigarettes as much as we used to. Let's go back to the questions, Craig. This one comes from Illinois, and this person's concerned. Their grandfather's on a ventilator, and the doctor tells them they might need a tracheostomy, and it's all because of smoking. Can you help me understand what a ventilator and tracheostomy is, and is it true, could smoking cause this?
To answer your last question, yes, smoking can cause that. A ventilator is a breathing machine. Basically what it does is patient gets so sick they can't breathe on their own anymore, and they're at the risk of cardiac arrest. So what they'll do is they'll put a tube down their lungs, hook a machine up to them, and basically this machine pushes oxygen in and volume in and out of their lungs so they can breathe without having to work on their own. And it lets them rest and get over their symptoms. A tracheostomy is where we put a hole in their neck with a tube in there, and most of the time we use that on patients who've been on a ventilator a long time. We can't get them off, and it helps them so they can feed them still and clean their mouth out and stuff still. But sometimes patients need those long term because it cuts down on a lot of the resistance to breathing of the upper airway, and it helps them breathe easier that way. But it's not something you really want if you don't have to, because there's a lot of infection risk around the site. There's a lot of cleaning involved, and it's just it's a whole nother ball of wax you have to deal with. But
So basically, cigarettes can cause all sorts of these lung problems, which could lead to a ventilator.
Right. That's part of the worst case scenario. Well, dying would be a worst case scenario. But that's probably the next step before that. And that's serious. If you're on a ventilator and getting a tracheostomy, you've done a lot of damage to your lungs.
Well, I think it's important to know, because there's smokers out there, this is a future that they might have if they don't do something about it.
Right.
And the next question really focuses on what we can do about it. And this is a person from Minnesota. She says, I so badly want to quit smoking. Can you give me some practical suggestions of where to start? I talked to my doctor and he says, just quit.
That's probably not the best advice to say just quit, because it's not that easy, and everybody's different. I've seen people quit cold turkey before, and it can happen even for heavy smokers, but not everybody's the same. Some people have more addictive personalities. Best place to start is where you started right there. You say you want to commit to quitting. That's the best place. That means you're ready to do it. Next for me, I'd be going to God. I'd say, God, help me out here. I need to quit smoking. I want to make my life better. I want to be able to live to see my grandchildren, or I want to live to see my children grow up, or whatever's going to motivate you to want to quit, and ask God to help you do that. And then start doing some research. We've got the internet, got my book. There's ways out there to help you. There's clubs that meet together, better breathing clubs that are helpful. If you have someone else you know who might want to quit smoking, team up with them and really commit to doing this. You can't do it half-heartedly. It's very trying to quit without being fully committed to do so. But the first step is admitting that you need to quit and that it's bad for you and you know it. And the next step is to say, God, help me out here. I'm praying to you. You can heal, you can cure. I want you to do this in my life, and then go from there.
Now, how do you feel about all the medications out there? And there's been several over the last 10 years that have been used to help people. How do you feel about those, Craig?
I got mixed emotions on them. I think they can be helpful, and I've seen people quit from them. I mean, I'd like to start off, I'd at least start off trying weaning, cutting down. Not cold turkey, wean yourself off the cigarettes. If that's not helping, you know, some of this, there's nicotine gums, there's nicotine replacements. They can have side effects. There's non-nicotine replacements, like we mentioned earlier, Xantex, or Chantix, I mean, and then Cymbalta, I think is the other one. These are, that'll help you do that, so.
You know, I know we can't cover everything out there about cigarettes, but I think that, you know, the 2 points I think you've made is that it damages the body, it's addictive, and it's still a major health problem in America. Craig, I want to thank you for being with us today. And if anyone might have a question, they can come to our website at heartwiseministries.org. We'd be happy to answer your health question. We'd also be happy to answer your prayer requests, as we would like to pray for you to be able to quit smoking. And I want to emphasize Craig's book again. It's called Breath Wish, and it could be purchased at outskirtspress.com, or you can go on the internet, amazon.com, and get this book. Hope you join us next time on Heart of Health.